Dr. Lee, and now we will discuss the musculoskeletal system. This is MBC 101, Unit 5 lecture. The objective of this presentation is to identify the organs and other structures of the musculoskeletal system. We will define, pronounce, and spell types of body movements, define and spell the word parts, and build and analyze medical terms using word parts. We will also define, pronounce, and spell the disease and disorder, diagnostic, surgical, and complementary terms for the musculoskeletal system. We will interpret the meanings of the abbreviations, read medical documents, and interpret medical terminology contained in them. And lastly, we will identify and use plural endings. So let's talk first about the functions of the skeletal system. The skeletal system provides a framework for the body. It protects the soft body parts, such as the brain. It stores calcium and produces blood cells. The body contains over 206 bones. It provides movement, posture, joint stability, and heat production. And the body also contains 600 muscles. So let's look at the body structure. First, you have the periosteum, which is the outermost layer of the bone. It's made up of fibrous tissue. Then you have the compact bone, which is dense, hard layers of the bone tissue that lie underneath the periosteum. You also have the cancellous spongy bone, which contains small spaces like a sponge and is encased in layers of compact bone. You also have the endosteum, which is the membranous lining of the hollow cavity of the bone. Let's continue with the bone structure. You have diaphysis, which is the shaft of the long bone, epiphysis, which are the ends of the long bone, bone marrow, which is material found inside of the cavities of the bones. You have first red marrow, which is thick, blood-like material found in flat bones and the ends of long bones. And you have yellow marrow, which is soft, fatty material found in the medullary cavity of long bones. So this graph shows a very good depiction of the bone structure. So starting at the top, right, you have the articular cartilage, which it's very important to have cartilage in between, close to those joints. Then you have a spongy bone and the epithelial seal. And you see those little red dots kind of comprise the red bone marrow. Then you have the endosteum and compact bone, the medullary cavity, the yellow bone marrow that we were talking about in the periosteum. And you also see how the nutrient-rich artery is feeding this bone. And on the other side, on the left-hand side, you see how it's divided in proximal epiphysis, metaphysis, diaphysis, and then at the bottom, you also have the metaphysis and the distal epiphysis. Now, the jawbones are maxilla and mandible. So maxilla is the upper jawbone and mandible, the lower jawbone. The vertebral column is also made up of bones, and those are which the spinal cord runs through. So it protects the spinal cord, very important. So you have the cervical vertebrae, which is the first set of 7 forming the neck. Those are C1 through C7. Then you have the thoracic vertebrae, which is the second set of vertebrae. Those are 12, and that's T1 through T12. You also have the lumbar vertebrae, which are the third set of 5 large vertebrae, and that forms the inward curve of the spine, which is L1 through L5. Continue with the vertebral column. You have the sacrum, which are the next 5 vertebrae, and those fuse together. The coccyx also fuses together to form the tailbone, and that's 4 vertebrae. And then you have the lamina or plural laminae, which are part of the vertebral arch. Now these are other sets of bones, but they're much smaller sets. You have the clavicle, which is the collarbone, the scapula, shoulder blade. You have the sternum or breastbone. You have the upper extremities, arm and hand bones, and you have the humerus, the ulna, the radius, the carpals, which comprise your fingers, and the metacarpals. And then you have the phalanges. Now on the pelvic bone, you do have 3 pairs fused together. Those are the ilium, the ischium, and the pubis. And then on the lower extremities, or speaking about your leg and your foot bones, you have the femur, the patella, the tibia, the fibula, the tarsals and metatarsals, and your phalanges. So again, you have a very good anterior and posterior view of the musculoskeletal system here. So starting at the very tip of your fingers, you have the phalanges, carpals and metacarpals, make up the rest of the hand and wrist. And you have the ulna and the radius making up the forearms and your humerus. And then as you move up, you have your clavicle, scapula, sternum, your ribs, obviously, enclosing your chest, thoracic area. And then if you go down to the extremities, the lower extremities, you have your femur, your patella, your tibia, your fibula, okay? And your tarsals, metatarsals, and phalanges. And obviously on your head, you have your cranium that protects your brain and your mandible. So very good anterior view, and then on the posterior view, specifically on the muscular side of the musculoskeletal system. And this ends this presentation for today. See you next presentation.